Looks like we still have a bunch of people joining us at the last minute. Great thing about webinars is we can just drop in from anywhere on the planet right in the middle of our busy schedules. That's why we scheduled these for lunchtime, at least California time, where 3 out of 4 of us are right now. Hopefully people are jumping in on their lunch break. We have over 70 attendees in here so far. And probably around 300 registered for the webinar series overall. Our original goal was about 200 people, so we're already super thrilled and impressed. Well, we're about a minute after 12. We have a lot of stuff to go through here and a lot of exciting stuff. We want to get this started. I know some people are still filtering in. Again, this webinar is being recorded as we speak, and anybody who's registered for the session will be able to gain access to this recording after we process it. It'll be a couple of weeks. It'll be available. So we're going to get started. My name is Brad Burge. I'm the Director of Strategic Communications for the Multidisciplinary Association for Psychedelic Studies, otherwise known as MAPS. I'm just going to give a quick technical introduction to AnyMeeting here. AnyMeeting is a platform that we haven't used before in our webinars. We've hosted a number of webinars using other platforms, so this is our first time using this. If you're using Chrome, you're able to access directly through your browser. Otherwise, you've installed a desktop app, which has been pretty cool. So I'm going to give you a quick walkthrough with this, and also just ask for your patience in case we encounter any sort of technical difficulties, this being our first time using this platform. So up at the top of your screen, if you're an attendee, you'll see a few buttons. One of which is a mood button. I see a lot of people are still using that. You can indicate your current mood. I think this is really cool in the absence of having a live audience about how you're feeling about the content or what's going on. So if you're confused or upset or happy or think it's a bummer, like you can indicate all of those things too, and maybe it'll help us direct the conversation, or maybe we'll just look at the pretty pictures. But anyway, it's a cool feature to play with. Also, we'll be having a live Q&A at the end. There's probably no way we can answer all of the questions. So what I'm going to do is I'm going to be collecting those in the background while you're submitting them, organizing them into categories, and trying to get as many of the sort of core issues that are being asked responded to as possible. And then via my friend and colleague Bia Labate here will be picking from those and asking them of the presenters. So please feel free to ask your questions starting now. Feel free to submit those or once the presenters start talking, and we'll do our best to get those. We've also sent around some free resources, some background resources, which I will send out to the attendee chat once we get started here in case you haven't been able to access those already. Then finally, if you have any questions about the webinar as we're going, we're a small company here, so we try to get back to you as quickly as possible. You can email events, that's events @maps.org, and we'll try to get back to you as quickly as possible. That said, thanks again. That's all for my technical introduction. I'm going to turn off my video and turn it over to the amazing Dr. Bia Labate, who has curated this content and prompted the idea for this psychedelic science series of webinars. Bia, thank you so much, and off to you.
Hi, Brad. Thanks for your very nice, generous words. Actually, Brad co-curated the content with me. So just introducing myself quickly, my name is Bia Labate. I am a Ph.D. in anthropology. And I'm happy that recently I got a job in MAPS. I am public education and cultural specialist in MAPS, as well as executive director of Chacruna. ChacrunaNet is an organization that is based in the Bay Area. And this is kind of my first assignment in this job. And the whole idea behind this webinar series is in alignment with my position here in MAPS, which is to make academic knowledge more accessible to the wider public. So we want to go beyond the high walls of academia and spread knowledge to people and make people learn and understand what scientists are doing. And also hopefully, make you all guys, I suppose some of you are researchers, not everybody, but to show how fun, how exciting, and how challenging it is to do research. So we also encourage you to, by learning in this series, maybe start your own projects. If you have a dream to do some research in psychedelic science, it's a way that you can get in touch with the researchers, learn a little bit about the backstages, some of their dilemmas, and also for you to give feedback to the researchers on topics that you think are important, that are missing in the scene of psychedelic science, that you would like to see addressed. So a lot of what you can do in this webinar is have a kind of relationship to science that goes beyond of what you see, in research publications or in conferences, because frequently a lot of those issues are not addressed in any kind of space, public space. So this is one of the main goals. And of course, the obvious major goal is to just, give notice to the amazing research that is happening in this field, blossoming on multiple fronts by multiple disciplines in different parts of the planet. And in this regard, it's a real pleasure to start with Brazil, not only because it's my homeland, that would be biased, of course, but it's because we are really doing some amazing work in Brazil. Brazil is turning out.
Thanks for
one of
the phone call. I appreciate it. This will be more efficient.
Brazil is one of the places that has strongest development of the field of psychedelic science. In Brazil, the use of ayahuasca is allowed for ritual and religious contexts, and this has favored a culture that of investigation, of exchange, where researchers can talk to ayahuasca using groups, and communities visit their rituals and have a dynamic interchange with what's going on in the field. A lot is happening there, and we're going to hear from two of the people that are pioneers in this. So it's my pleasure to introduce our first speaker. I'm going to introduce both of them actually, but first we're going to have Luis Fernando Toffoli, who you might wonder is always called Toffoli. So that's a clarification. It's not very conventional to call somebody by their last name, but that's the case of Toffoli. And that's not because we're formal, but everybody calls him like that. So you can feel free to call him Toffoli. Toffoli is a psychiatrist at Unicamp, that is an important university in the city of Campinas. He has been very active in the field of mental health for 2 decades, and in the last few years has started researching ayahuasca and has done incredible things with his institution called Icaro. He's going to talk more about it, and I think that he can hold proudly in his CV that he has managed to plant some ayahuasca vines in campus with permits of authorities. So that's one of the interesting things that is happening in Brazil. He's going to talk about a research that has not been presented, to my knowledge, anywhere else, which is a recent paper about the potentials of ayahuasca to treat tobacco addiction, and also some ongoing research that him and Icaro are doing in São Paulo and Campinas. So thanks a lot for joining our webinar. We're very excited. There's more than 200 people registered, and welcome. With you, the word, Toffoli.
Thank you, Bia. Thank you all for your presence and your interest on the field of ayahuasca and psychedelics. So we're gonna need some help with the presentation. I don't know how to activate it. I have a PowerPoint presentation.
Yep,
to show you guys.
I'm getting that up right now, Toffoli. You should have it in a second.
Thank you very much, Brad, and thank you, Bia, for this invitation, and thanks to MAPS as well. So I'm gonna give you a very brief presentation trying to ask this question: can ayahuasca treat tobacco addiction? All right. So as Bia said, I'm a psychiatrist and a professor of psychiatry at the University of Campinas, Unicamp, and I'm the head of a group which is called Icaro, Interdisciplinary Cooperation on Ayahuasca Research and Outreach. And we truly are very interested about the different aspects of ayahuasca, from the botanical fields to the anthropological aspects, from the neurochemical and chemical to the human interaction with this group, all right? So for those who are not So this is the agenda for the presentation. I'm going to give you a very brief explanation on ayahuasca for those who don't know what ayahuasca is. And then we're going to examine some evidence, trying to answer the question about the possibilities of using ayahuasca for the treatment of tobacco addiction. We're going to have a look on the evidence that we have already available about other psychedelics, and this is basically what we have is from psilocybin, and then some studies from ayahuasca, and then results from a specific study from our research group, and this is the first time that this has been publicized. And then we're going to have a brief discussion about which could be the mechanisms of action of ayahuasca, for if it's possible to treat tobacco addiction, and also a very brief discussion about the future goals about ayahuasca and for the treatment of smoking and tobacco smoking, right? So first, what is ayahuasca? When we talk about ayahuasca, a lot of people think about DMT, dimethyltryptamine, which is a classical hallucinogen, a classical psychedelic, a serotoninergic psychedelic, which has as basically all serotoninergic psychedelics activates the receptor for 2A for serotonin, and it's a very potent and very fast-acting psychedelic. And if you take it orally, for instance, if you take one of the plants that has DMT, in the case of ayahuasca, normally it is the chacruna plant, Psychotria viridis. And if you make a brew out of it and you drink it, it's not going to bring you any expansion of consciousness, or actually not much of any kind of a mental alteration. And that happens because we have an enzyme called monoamine oxidase that is present in the gut and in the brain that deactivates this substance when it's taken orally. But in ayahuasca, when you cook ayahuasca, it is cooked using a plant that contains DMT and the ayahuasca vine, which is named its scientific name is Banisteriopsis caapi, and it contains a lot of alkaloids. The three main alkaloids that are supposed to be the active ingredients of ayahuasca are harmine, harmaline, and tetrahydroharmine. And they block the action of the MAO, and so DMT can act in the brain. One thing that is usually in the past, ayahuasca was thought as some sort of oral DMT, as the only active ingredient that would be important would be DMT. It is responsible for the main effects of the expansion of consciousness, that's for sure. But recently, we are having a lot of new discoveries, new research, showing that the components from the vine are also very important. And one thing that we have to keep in mind is that the indigenous groups normally call the brew by the name of the vine. So that's that's something also we have to take into account. All right. So now let's think about tobacco addiction, and the treatment of tobacco addiction. And then, first of all, we have a lot of anecdotal reports about people who have taken psychedelics and quit smoking or quit tobacco use, all right? And here, I'm not talking about the ritual use of tobacco, I'm talking about addiction, right? So from these reports, we can also find news reports on that, and even there's a story on Vice about a journalist that told their experience on quitting smoking with LSD. Considering what we have in science published papers, the evidence comes mainly from psilocybin, which is also an agonist of the serotonin 2A receptor. And this is a study from Johnson and colleagues from 2014. where it's an open label study. So everyone who took psilocybin knew that they were taking psilocybin. We had here a small sample of only 15 subjects, but even though after 6 months, after having psychotherapy and then experiences with psilocybin, they have a rate of abstinence after 6 months of 80%. There's nothing you're gonna find. There's no other treatment that you would normally find this such a high rate of responders, of quitters after 6 months. So even though it's not compared with any kind of other treatment or placebo, in this case you can see that at least from the numbers, it's worthy trying something else. We also have some developments from this study. So they have a long-term follow-up with 12 months and more than 16 months and 16 months. So after a year, 67% of the participants were abstinent, and after more than 16 months, 60% were still abstinent. So we're talking here about excellent rates of response. Also, there a development of this study as well by Garcia Romeu and colleagues, where they examining the response to questionnaires that are normally used to evaluate the experience. And so it was shown that those who had higher rates and scores of scales that would record the mystical experiences would be the group of people who would be more frequently quitters or would have a stronger change in craving. So it seems that the mystical experience is a predictor of a good response when someone takes a psychedelic for the treatment of tobacco addiction. Also, the same group from Hopkins, Johns Hopkins, also did an online survey to study the naturalistic tobacco smoking cessation from the use of psychedelic in a way that we could say it's not necessarily ritual, but recreational or social use of psychedelic. So in this study, they had valid responses for 358 subjects. Almost 40% of those participants were quitters. So they quit smoking and never started again during the period after, considering the time that they answered the survey. It was an online survey. So they divided, they split everyone who was invited should have some sort of response of tobacco smoking cessation, either quitting or reducing, or quitting and then relapsing. And these last were called relapsers. And the relapsers scored significantly lower in scales that would show the impact of personal meaning and the spiritual significance of the psychedelic experience. So once again, when the experience is more significant in personal or spiritual terms, according to the scales, you have a greater chance that you're gonna quit smoking. And also there is the report for many of these participants that they experience less severe withdrawal symptoms. And that the authors suppose that could lead to a brain mechanism that could help with dealing with the symptoms of withdrawal when someone is quitting smoking. All right. And also they reported very important changes in their lives in these experiences. They were very meaningful for their lives when they also had an impact on tobacco smoking. Moving on to ayahuasca, we have a lot of anecdotal evidence on that from the ayahuasca Brazilian religions and from other ayahuasca experiences about people who drank ayahuasca and quit smoking. And from the very first academic biomedical study on that, which is the Ayahuasca project that was done by Charles Grobe and colleagues in Brazil in the last decade of the last century. Also, there was this report of a lot of participants, also a small sample, but they also told that they quit smoking after they started attending UDV sessions. The UDV is one of the Brazilian ayahuasca religions. UDV is the short for União do Vegetal. Also, we have this study from Thomas and colleagues with First Nation people in Canada, where they recorded the impact of ayahuasca, ritual ayahuasca drinking for Native Americans, Native Canadians in this case, 12 of them. And as you can see with the arrow, you have the line from tobacco use. So we can see that using the 4-week substance use scale, they have lower rates of tobacco use after the follow-up, and that means after the experience of ayahuasca. This also was not controlled, but this was not significant. Okay, I'm back again. So, but this may be a sign that with the larger samples, we could have some results that would be significant. But in this case, and here we're talking about Native Americans that ritually use tobacco as well. So it might be not the same thing for Westerners. Here we have, I'm a member of the research group that was led by Paulo Barbosa with the participation of Michael Bogenschutz, and the senior author is Michael Winkelmann. There was a survey on the use of tobacco and alcohol on UDV subjects. And what we saw in this study is that the lifetime use of the UDV group, the UDV participants, was higher than the Brazilian norm for the population from 25 years and older. But the current tobacco use disorder was significantly lower compared to the Brazilian population, the normal Brazilian, the general Brazilian population. And as we did a regression analysis, there was a significant impact on this quitting or this cure of tobacco use disorder. There was an influence from the attendance of on ayahuasca ceremonies. That means going to the UDV rituals. And also there was an impact on the number of years of membership to the UDV. So in this case, we're seeing that if you drink ayahuasca a lot, you may have lower rates of tobacco use disorder. But one thing that we also have to keep in mind is that the UDV is a religion. So it's both ayahuasca drinking and attendance to a religion. And here are the new data that I would like to present. This is going to be the first time I'm going to present these results. We did an online survey that replicated a lot of the methodology that was used by Johnson and colleagues in their online survey. I was helped by Dimitri Daldegan, Carolina Massarenti, and Lucas Maia, the three that are here in the pictures. But in this case, we did an online survey exclusively for Brazilians and exclusively in Portuguese. So participants had to report that they had reduced or quit tobacco smoking after one or more ayahuasca experiences. And we had 452 valid answers. One interesting thing about this group is that our number of quitters was much larger than the study from Johnson and colleagues. They had 38% of quitters. We had 70% of quitters. We also had other groups, those who had reduced. I'm sorry for the slide in Portuguese, but you see here in green those who had reduced but hadn't quit completely. In blue, those who had quit but when they relapsed using a smaller number of cigarettes than before. And in pink, those who had quit, and then when they started the same as before, and a very small amount of those who had, after quitting, started using more than before, all right? So we compared those who had quit with the other groups, those who had reduced and those who had quit and then relapsed. And here we are trying to predict quitters, the quitting response. So not being a single person, that means being married or widower or separated, had a significantly impact on the chance of being a quitter. Also, being older, with a 3% chance on each year of being a quitter. Being a frequent user of ayahuasca compared to being a not frequent user. And also, similarly to what has been found in other research, we saw that higher scores in the mystical experiences questionnaire subscale, called mystical subscale, was also a predictor of being a quitter. Once again, having a mystical experience is related to quitting smoking. And something that we're still having to study is also the impact of a positive mood scale, which is describing a lot of pleasant experiences. In the ayahuasca experience that participants reported that was related to their the main experience that made they quit. So these pleasurable experiences were not related, were negatively related to quitting. And so we are still trying to figure out what that means. These results are preliminary. We still have to work on the data bank. Other variables will be included, so this might change in time. But so far, we have very interesting results, in my opinion. So a very, very brief discussion about how could ayahuasca treat tobacco addiction. First of all, we have this general positive effects on mental health that could be translated by the results from the ayahuasca study on depression and other studies studies on depression. It's not only one, I'm just showing one. So also everything that has a good impact on mental health could be also have a good impact on tobacco quitting. Also, something else is that tobacco is a MAOI inhibitor. There is a theory that says that perhaps this has to do with craving. So far, the literature doesn't solve this riddle. We don't really know if MAOI inhibition is a very important aspect related to tobacco craving. But since we are dealing with monoamine oxidase inhibition with ayahuasca, that might be also an influence. The peer pressure and the social setting of drinking regularly, and especially drinking in a religion, cannot be ignored. This probably is also a very important aspect. The issue of neuroplasticity that's being it's a new trend that's being discussed with psychedelics. We have a very recent paper by Lai and colleagues about that. And also what we could discuss later, because my time is over, about the non-specific effects of ayahuasca and other psychedelics. If psychedelics could be like super placebos, if their impact and the expansion of consciousness, and only this is an influentiator, and not that we really have a specific effect on terms of neurotransmitters that would have an impact on any of the good results that ayahuasca seem to have in mental health. Just to finish, what we need to know, what we need to do, we have to obviously, and this is more or less what we see in every conclusion of studies, we need more research, we need more basic research, specific on the field regarding nicotine and tobacco, neuroimaging, animal models, in vitro studies, and also clinical trials with ayahuasca. We know that there is a study that is recruiting for psilocybin treatment with controlled, with nicotine replacement therapy. So we should do open studies and also placebo and other treatment comparisons for ayahuasca as well. So I thank you very much for your attention, and I hope for a very good discussion after Dráulio is finished. Thank you very much.
Dráulio.
Yes.
Yes, go ahead.
Oh, okay. Well, it's a pleasure to be here. Thank you, Bia. Thank you, Brad.
I'm sorry. I forgot to introduce you.
No problem. I can just go ahead. Don't worry. Yeah. So, yeah, it's a pleasure to be here. Thanks, Bia, Brad, Maps. It's a really great initiative to, spread, the knowledge, different types of knowledge. So I wish you guys, all the best of luck for this whole web seminar series. My plan here then is to follow up on what Toffoli was talking about. I don't have any presentation, so the plan is to go through the story of the type of research that we have been doing and the type of research that we have been interested in the past few years. So our group have been studying or doing research with ayahuasca since 2006. Our first couple of projects were more devoted to understanding the neural basis of the ayahuasca effect. In other words, I work as a neuroscientist at the Brain Institute in Natal, Brazil. And our plan back then in 2006 was to understand or to try to find neural representations of some of the acute effects of ayahuasca. And in order to do so, what we were doing back then was programming experiments in which we could use neuroimaging techniques such as MRI or EEG and then have people being volunteers for these studies. And in these studies, basically, you would have volunteers under the influence of ayahuasca go into an MRI scanner or to an EEG equipment and then perform a number of tasks. And in order to do so, we were recruiting all of our participants. They were very experienced people from some of the ayahuasca churches in Brazil, particularly in this case, the Santo Daime Church in São Paulo, which was the church that we were recruiting most of our participants. And by having this contact with people from the church, it became very clear, as Toffoli was mentioning before, that there were a lot of people in the church that spontaneously would come up to us saying that they got better from a number of issues that they were facing before they started going to ayahuasca sessions, such as alcohol addiction, tobacco addiction, and other substances such as crack and cocaine. And also a lot of people saying spontaneously that they got better from their depression, from their mood disorders, particularly depression and anxiety. So in parallel to investigating the neural basis of the ayahuasca effects, we started our interest in trying to explore a little bit more and using a scientific basis kind of exploration to find out, to quantify better the eventual antidepressant effects of ayahuasca. So the first set of studies that we did back in 2008, 2009, they were led by a psychiatrist from São Paulo called Jaime Halak. And the first idea then that we had was basically to transport transport an ayahuasca session from a traditional setting, from a church, into a hospital. So basically, the first set of experiments that we designed was to, one, see how patients with depression would deal with an experience with ayahuasca. Second, how was that experience going to be, considering that we were going to give ayahuasca to these patients in a clinical environment, so in a public hospital. So the first question we had was how would these patients deal with the experience? How safe would it be to have people with severe depression going through an ayahuasca session in a hospital? And also to understand preliminarily the antidepressant effects of ayahuasca. So the first experiment that we did is what we call an open label trial. So basically what you do is you give ayahuasca, a single session of ayahuasca for patients that have what we call treatment-resistant depression. This is just a technical term, and it's an important technical term for ethical reasons. We have to recruit people that are not responding to conventional treatments. And this is basically what we call treatment-resistant depression patients. In other words, are patients who have not responded to at least 2 different antidepressants, conventional antidepressants, at maximum dose. So in the first study, we recruited 7 patients with treatment-resistant depression, have them come into the hospital. They participated in a single session with ayahuasca, and we tracked down their depressive symptoms based on clinical scales for depression. In other words, we had psychiatrists applying a scale, a questionnaire, in which you're capable, a validated questionnaire, in which you're capable of assessing how severe is the depression of that patient. So we did that in 7 patients in the first study. And basically what we found was that first, patients could deal with the experience in the hospital. So some of them had very challenging experiences, but even so, they could deal with it. It was nothing very different from what you would expect from an ayahuasca session in a traditional setting. And also from our first investigations, we did see that there was a significant decrease in the depressive symptoms. So they got better. Significantly better after a single session with ayahuasca. So the follow-up study, basically what we did was to increase the number of patients. So in the first study, we had 6 patients. In the second study, we had 17 patients, but that was still an open label trial. In other words, we would give ayahuasca to every patient. And both the patients and the experimenters would know that they were being exposed to whatever treatment we were hoping to give them a better outcome for their depression symptoms. So what we got from the second study was basically very similar or in line with what we got before. So we did find again a significant antidepressant effect of ayahuasca already 1 day after the session. So 1 day after the session, they got better from their symptoms, and that improvement lasted for 21 days. In other words, with a single session of ayahuasca in these patients with very severe depression, we would still see a significant and long-lasting effect of a single dose of ayahuasca that lasted for 21 days. With these promising results, then we decided to move on and to do what we call a randomized placebo-controlled trial. And for randomized placebo-controlled trials, it's a very basic step if you're testing any medication from any human condition. So basically, you have to compare the effect of the substance that you're testing against a placebo. And that is significantly important when we consider that we're testing a substance against depression, because in clinical trials for depression, we expect to have around 40 to 50% of people responding positively to a placebo session. So in other words, if you have a clinical trial for depression, 40 to 50% of the patients will respond to the placebo. So that's a very important thing to control in any study that you're interested in exploring the antidepressant effects of any substance. So basically, this was the follow-up experiment. So we had now an experiment in which half of the patients would have a single session with ayahuasca, and the other half of the patients will have a single session with the placebo. I want to mention that having randomized placebo-controlled trials with psychedelics is a very challenging task, because of course you're not going to be able to convince people that had an experience with ayahuasca that they had an experience with placebo. In other words, there's no one that will misattribute the experience to the placebo when they were actually under the influence of ayahuasca. And that's true for any psychedelic. So it's very hard to have a placebo or a randomized placebo trial in which you in which you can hide from people who had an experience with a psychedelic that was not the psychedelic. So that's not the case. So basically, the strategy to do randomized placebo-controlled trials with psychedelics is to have placebos or placebo substances that have some kind of effect, either a psychoactive effect or any other kind of effect that resembles the effects of the substance that you're trying to test. And this was basically the approach that we took. So we developed a placebo that would have some of the effects of ayahuasca. In this case, we were not aiming for psychoactive effects of ayahuasca. We were aiming for the gastrointestinal effects of ayahuasca. In other words, our placebo substance had zinc sulfur in it, and zinc sulfur, besides being bitter, it also has, it brings you a little bit of nausea, vomiting, and diarrhea. So depending on the dose, all people will have nausea. Some people will tend to vomit, and less people would have diarrhea. So this was the strategy that we took to have a randomized placebo-controlled trial. So in this controlled trial, we screened 218 patients. And out of the 218 patients, we recruited 35 patients. That was a 2.5 year-long project as far as collecting data for the patients. The patients would stay with us for 4 days. In other words, we would have a lot of contact with the patients. We would have a lot of opportunity to bond to the patients. We would have a lot of opportunity to tell the patients what they were to expect. And we would also tell the patients the same instructions, regardless of if they were going to an ayahuasca session or if they were going to a placebo session. The instructions would be just the same, which were just reporting and telling them what kind of experience they would expect from that session and so on. So for that experiment, then, as I said, half of the patients had a single session with ayahuasca, half of the patients had a single session with a placebo. And the results were really promising in the sense that we still saw a significant antidepressant effect of ayahuasca, this time even when compared to placebo. So although we had a very significant placebo effect to a point that at 2 days after the session, 67% of our patients responded positively to the placebo. So almost 70% of the patients got better after a placebo session. And that informs a lot about the importance of having a placebo study for when you're testing an antidepressant substance. And second, it also informs that the placebo mechanism is something that's very important, as Toffoli mentioned. It also informs a lot about the antidepressant effects that we're seeing. Basically, then what we saw with this trial was a significant antidepressant effects of ayahuasca already 1 day after the session. So people got significantly better 1 day after the session, and we found that that improvement was still observed 7 days after the session. So after 7 days after the single session with ayahuasca, patients were still showing a positive antidepressant effect. This was a very small randomized placebo-controlled trial, not small as compared to other ones. It's just that as for the first randomized placebo-controlled trial, we expect to have a sample size of around 40 patients, and that's basically what we had, but still a very small number of patients. So we only had 35 patients participating in a single session with ayahuasca. One point that I want to raise is that there's a lot of discussion around diversity and studies with psychedelics and studies with ayahuasca. I just want to mention that in our study, 80% of the participants came from very low socioeconomic status. So I'd say that, this study was very inclusive. In the sense that actually we were studying people that were coming from very difficult realities in Brazil, and it's also worth mentioning that the place where this randomized controlled trial took place, it is in a city called Natal, which is in the northeast of Brazil, which is one of the poorest part of the country. So I just want to mention that, in fact, for this trial, most patients, they actually came from very low socioeconomic status. And so with that, I'd like to conclude and I'm open to, and looking forward for the question and answer part of the webinar. Thank you so much.
Thank you, Dráulio. And, he did not tell a lot about himself, but he is one of the more important researchers in this field nowadays. This is the first clinical trial that happened with ayahuasca in the world. And it's, his paper was rejected by 12 journals until it got finally published. So it's a great accomplishment. I think that everybody was puzzled with these rejections because it's such a great study. It seems that almost as the medical establishment was not ready for it. It's so pioneering and it's so inspiring. And Dráulio was modest to refer about himself. He also has a lot of other virtues. Those of us who know him, this came up in Horizons. People were trying to make a kind of strong difference between science and practice. But those of us who knows these researchers know that that's not all about science. They have other sides that we don't know necessarily in public. I wanted to make one comment to Toffoli and then pass the word to him and then make another to Dráulio and then go a little back and forth. I'm very pleased to see Toffoli presenting this research because it's new. And I wonder if this is, he could tell us where this will come out or if this is subjected at which stage it is. And I also just wanted you to clarify maybe one concept to the public, which is the difference between the idea of like abstinence and harm reduction involving tobacco use. Because on the one side, you have the idea of complete abstinence, that is like quitting or stopping all drugs. And on the other, you have the idea of harm reduction. Although people normally accept the idea of harm reduction in more progressive circles, for example, alcohol or cocaine or heroin, if you reduce your use, you are in better shape. You don't necessarily need to quit it. But perhaps tobacco is harder to understand this concept of harm reduction in the case of tobacco, because can you just smoke a little and not too much? So you mentioned that you were trying to address both quitting and just having a new relationship to tobacco. I would like to know if you could clarify a little bit more about that. And then I'm going to make my traditional provocation for you, just for the sake of our constant tradition. So Toffoli and I have worked on different projects, including a multidisciplinary conference in Brazil called On Sacred Plants. And we like this interface between psychiatry and anthropology. He's a kind of anthropologist wannabe, and I'm kind of a psychiatrist wannabe. So we exchange a lot. I don't understand why you have to say non-specific effects, and why can't you just say meaning or context or culture or group? Why do you have to separate something that you can measure or identify as social context and meaning, and then the other category is this mysterious one, non-specific effects? What's the difference between social context and non-specific context? Those are my questions for you. And thanks again for sharing unpublished data. A lot of researchers are jealous and don't want to share unpublished data, and so this has special values to us. Thanks.
Hi there, I'm back. Can you hear me now? All right, great. Having some echo. Okay, I'll try to do it slowly because with echo is difficult. So we are in the stage of we are analyzing. These are preliminary data. Are you listening to me? Are you listening to the echo or not? Yes. I'll try to rejoin it again. I don't know if Dráulio can answer a question while I'll do this. Just a second.
Okay, let's move to Dráulio, since Toffoli is gonna try to fix this technical problem. So to Dráulio, I just want to say bravo and congratulations on having your paper out, and thank you for your work. And perhaps you could tell people, since it's in the alignment of the spirit of the webinar, why do you think your paper got so many rejections, and what is it like to feel that, and what can you share about doing the backstages of this research and the so-called famous peer review process?
Well, I guess that science is going through a crisis, and that hit very heavy in science that you do not have a lot of support, so you do not have any previous results. So, and I guess that as for our study, there are, in my opinion, many different reasons why it got rejected so many times. But I think that the main one is the fact that ayahuasca is so out of the radar, even more than other psychedelics, that people just tend to, not look at it seriously. So although I'm pretty confident that the research we've done was conducted very rigorously with a lot of people. So I'm pretty confident that the science we're doing is good science. And of course, when you get, almost a year and a half trying to publish something that you're confident that's good, the feeling is not good. So the feeling of being rejected so many times, it's not a good feeling. And it informs a lot about peer review, like what you're saying. It informs a lot about the type of science that we're doing. But I'm confident also that we're moving forward. We're moving forward as far as convincing more and more people that this type of research is important, and this type of research might be actually a wonderful opportunity for psychiatry and for psychology and for studies of the human mind. These type of studies, I'm sure that they will be very mind-breaking, in the sense that we're going to see really interesting stuff coming out in the next few years, I guess.
Yeah. Thank you, Dráulio. It's always refreshing to see your optimism. I have read some of those reviews, and what was interesting is that frequently they didn't make a lot of sense, or they got stuck. Like, the reviewers agreed to the edits, but somewhere down the line the editor wouldn't agree to publishing. So it almost looked like there was some kind of spell. And I think definitely that ayahuasca, being a substance that has different plants and it's not a synthetic product, confused them. And the fact that it's used ritually also confused them, because it's kind of hard to separate the variables of what is religion and what is the substance. That has a lot to do with the presentation of Toffoli. Since we inverted the order, I'm just going to ask you another question, and then we can go back to Toffoli. So you mentioned that you were in Natal, and I visited that hospital where you host the sessions, and you were so proud showing to me the room, and you said, "Isn't it incredible?" And I was a little bit embarrassed because it was so simple and so modest. But I know Natal is so poor, and it's the northeast of Brazil, is out of the main circuit of money and funding and science. And you mentioned that some of the research subjects just were thrilled to stay there in that room. It was like a 5-star hotel, to spend like 5 days in the hotel, in the hospital, being served by different people and answering different questions and formularies. And now you're spending a year in Santa Barbara in the US. So I just wanted to know, do you have any perspectives or commentaries about this cross-cultural experience of being a guy that has been based in Natal and is now based in Santa Barbara, US, the differences between your scientific background there and what you face here? And more than that, what's next for you in your career? And what's next for the ayahuasca field in the US? What do we need to do here?
So yeah, definitely there's a big gap between, doing science in Natal, particularly a very poor, like I said, very poor part of the country, and, coming to Santa Barbara. It's just a totally different perspective, in a sense that naturally, for instance, we do not have to deal with diversity in the studies in Natal, because it actually is very hard to find participants that are, that have the same background as the participants that are being recruited in other psychedelic studies. So it just feels that the study that we've done in Natal, it fills a gap in which we would have people from a very different background that most psychedelic studies have been, doing nowadays. So this is a big difference. But at the same time, it's very rewarding, in a sense, to do research in a place like Natal, and to give, hope to people, like you're saying, hope to people that don't even want to go back to their own house or to their own realities. Like you said, a lot of our participants would just say, I'd rather stay here. Can I stay here for the weekend? Can I stay here for 4 days? So we would have to say, well, I'm sorry, but you have to go back. And it was, like he's saying, to me, it was amazing to see, those people having access to something that they have never had before. So it's really rewarding, and for sure that was one of the reasons why we had such a high placebo effect, to a point that we were not calling it a placebo effect anymore. We were calling it a care effect. So it was more of, taking care of people. It was more of talking to people. It was more of giving people like the minimum that they didn't have. So this is I mean, it's a completely different perspective. It's a completely different setting that we're working in. As for the future, I guess that, it just seems reasonable that for now we just had a single session with ayahuasca. So all patients were just participating in a single session, and then after 1 week, they would just go back to a conventional treatment. So I feel that it's time to start doing a real or a closer to real treatment. In other words, not only giving a single session with ayahuasca, but trying to give repeated sessions with ayahuasca and actually looking for the long-term effects of a treatment, which is something that there's no study that have been looking at it. So I'd say that this, this naturally seems to be a next step.
Thank you, Dráulio. Let's go back to Toffoli. There's also a bunch of questions lining up here. Thank you all. Please send your questions. Even if we don't answer them all, we're going to take a note, and it helps us. Maybe Toffoli want to start addressing the points that I had commented before.
Great. Can you hear me perfectly now? Right. So first of all, about the stage of the research, we're analyzing the data, and so we are still on this phase, writing the paper, and we're hoping to submit it in a short period of time. So that's how it is. So that's also something important, because that's why I told it's preliminary data. We are confident that these variables will still hold after we go forward in the analysis, but it may be not. So we're going to see when it comes out, okay? About abstinence and harm reduction. So this concept has been, the concept of harm reduction, which is a set of procedures for helping the health of those who misuse drugs. I'm talking about drug misusers, not only users, and that either don't want or are not able to quit the use. And it was originally developed for opioid users. And we are applying the concept of harm reduction for many other drugs. You can use it for any drug. For instance, cannabis. If you vaporize cannabis, you're going to lower the harm that comes from combustion of smoking. The same thing for e-cigarettes. You're going to lower the impact of nicotine, of all the smoke, and you have only the doses of nicotine and stuff like that. So you have harm reduction strategies for all drugs. But specifically for the case of tobacco, that's one of the drugs that we normally look for abstinence. And obviously, it's interesting that a person could, if he or she wants to smoke a cigarette a week or 3 cigarettes a week, that would be desirable. But for practical terms, this is normally not feasible. It's very, very, very rare that someone can, after being an addict to tobacco, that someone can go back to be a non-addict users. And there are non-addict users of tobacco. They are not very studied. I'm one of them. I smoke like a cigarette per month or something like that. And I for some reason, I don't know, I don't get addicted to tobacco. And some people, and this distinction between those who are addicted and not, it's not very studied. Normally, you're going to study tobacco dependence and compare them to people who never smoke tobacco, or that don't smoke tobacco. And you don't compare to non-addict users. So this is a gap in addiction science that should be, studied, in my opinion. But in the case of tobacco, it's important to aim on addiction. This is something that normally we try to do. So that's why for us it was so important to look at the quitters in this subset. And I have to reinforce what I said, because it was very quick, that we were talking about everyone who answered the survey has had an experience of either quitting or reducing tobacco smoking. We didn't interview, or we didn't ask for people to answer if they had taken ayahuasca and had no effect on their tobacco use, because that also happens. But because this is an online survey, you are subjected to some types of biases that we were especially looking at those who had some sort of good experience, and then compare among them and try to see if we could find interesting variables that could be studied or tested in a future clinical trial. That's the rationale for that. As to the term non-specific, this is medical lingo, you know, and that's why I used it quote unquote non-specific. There is a criticism on Dráulio's work on the randomized placebo-controlled clinical trial on depression by a blog called The Neuroskeptic, in which the author, I forgot his name, mentions that perhaps ayahuasca and the other psychedelics are just tools that provide people with experience of awe, and just by the fact that you're experiencing awe, you're going to be influenced to change your behavior. But then that's why I put quote unquote. If psychedelics are capable of eliciting these types of experiences, such strong experiences, why call them non-specific? They're highly specific. So that's something that we have to study and understand. And that's also a conundrum with the studies. Which kind of placebo should we use? A full placebo with inert placebo with no effect at all? Or should we try placebo substances that have some sort of psychological effect that could be compared, or physical effect? So that's really a question for ayahuasca and psychedelic science in general. But I just wanted to bring the issue so we could discuss. I don't really know how to name these effects, how I could name them.
Just to understand, Toffoli, what you're saying, the non-specific effect, so you recognize there's the cultural effect, the context, the group, the community, and then you're separating this to this non-specific effect as a kind of general effect that anybody could like feel. But that's another thing than placebo effect? Or is this the placebo effect? Oh, I think we lost.
Yeah, I'm back.
You're back. Did you understand my question?
Yeah, I'm separating the social effects, the social setting. That's why I put it in another slide. So
but is the non-specific the same as placebo?
Yeah, that's a synonym for placebo. That's one of the synonyms for placebo.
Okay, well, regarding placebo is one of Dráulio's favorite topics, by the way. Dráulio is a kind of placebo freak. He is obsessed with the concept of placebo. And we have had some questions about placebo as well. I'm going to keep on asking Toffoli just to go back to the order, but then we go back to Dráulio. Toffoli, people have been asking things here that are not exactly of your presentation, but it's questions that people often have about taking ayahuasca and mixed with SSRI. So what is the recommendation that people that take SSRIs quit? How long should they quit? What is your 2 cents about that?
The thing is that we need more studies about that. The classical medical answer to things to ignorance. So we have a lot of ignorance about that. We have a paper which is 20 years now. It has about 20 years. And that says that the combination of ayahuasca and SSRIs could lead to a serotonin syndrome. And so there is a report of a case. The paper is by Charles Grob and Jace Calloway. And there is a case report of an individual who drank ayahuasca while he was taking fluoxetine, which is an SSRI. And he had a very, very strong experience, and which by the description of the case, in my opinion, when you read the paper, it's not so sure that the person is having a serotonin syndrome, or either if the person is experiencing what we call serotonin toxicity, which would be more or less the same thing, but with less severe symptoms. And the description of the case is what here in Brazil, in the Brazilian ayahuasca religions, we call peia, which is in English would be something like a spanking. So the ayahuasca is spanking the guy. And also he had a lot of issues because he was cheating on his wife, and this came to his mind. And those who have drank ayahuasca know that feeling guilty about anything can be a very harsh experience when you drink ayahuasca. We don't have any report of anyone who has died of a serotonin syndrome while drinking ayahuasca and taking SSRIs. And in Brazil, considering that you have a lot of people taking these drugs, and also a considerable number of people drinking ayahuasca, and a very good surveillance system for this type of toxicity case. And after all this 20 years, no case has popped out. So I would say that probably the risk of death, it's not so great, but we have to take caution. So what is, for studies, what is recommended is a washout period of at least 2 weeks. And during clinical situations, there are no clear rule for that. I know about people who just stop their medication like 2 or 3 days before they drink ayahuasca, or even 1 day before, and they keep taking their medication and drinking ayahuasca and having no problem with that. But obviously, I cannot recommend anything that is not based here. I cannot recommend anything that is not based on science, on evidence. So far, what I can say is that we need more studies on that. Sorry about it. And to be careful. Your mic's off, I guess.
Sorry. Thank you, Toffoli. And for sure, it's a paradox of psychedelics, because frequently the people that have more challenging mental health issues are the ones that would perhaps most benefit from psychedelics, but they maybe in some cases have also greater dangers. Same for people doing clinical trials. Sometimes you have so many rules to be able to join those trials or those research that a lot of people that could benefit cannot join the research because of those restrictions. Certainly an area that needs more research. I'm going to go back to Dráulio and ask. So I'm going to ask two questions here from the public. One is in alignment with your love for placebo issues. It's by Lizzie. How did the placebo group respond in the antidepressant work? And Joel is asking, what are the chances of future ayahuasca studies on depression being performed in the US? And Paul is asking something hard. How do we separate the effects of religious context from the effects of ayahuasca? That's also a good question for Toffoli. Also, if it seems to be true that religious context is vital to the benefit, how do we create a non-dogmatic secular therapy that doesn't lose this key factor? A question that perhaps not so easy to answer, but definitely a good point. And this also is appear frequently in ayahuasca community debates, because people respect the ritual and want the ceremonial use, but not everybody wants to join a religion or a shamanic context, but they also don't want to just go to a medical setting. and they want to keep the sacred somehow. So this is another crux problem the webinar is going to address in general, this relationship between ceremonial use and the context of psychedelic-assisted therapy. The word is with you, Dráulio.
So for the placebo effect, basically what we found is, so let me just explain a little bit better the design of the experiment. So basically we had half of the patients, they were all naive to ayahuasca or to any psychedelics. Half of the patients had a single session with a placebo and half with ayahuasca. When we look at the patients that had the single session with the placebo, what I was saying is that for the first day, 50% of the patients responded positively to the session with the placebo. In other words, 50% of the patients got significantly better after the session with the placebo. 1 day after the session, it was 50%. 2 days after the session, that number increased to 63%. And 7 days after the session, that number decreased to 26%. So it's an amazing effect. It's the placebo effect, like Pio was saying. It was certainly one of it was certainly one of the most interesting, effects that I've seen. So people that have depression for 25, for 30 years, you'd see these people getting better. And some of them, like I remember one patient that got cured for 6 months after a session with a placebo. So that's...
Charlie, can you see the slide from the results?
Yes, I can. Yes. So
can I leave it this way?
Sure. Yeah. So what we have here in blue is the severity of depression from the patients that undertook the placebo, and in red is the patients that took ayahuasca. So the effects of ayahuasca were superior to the effects of placebo, but nevertheless, the placebo effect was significant. So it's just something that we do need to understand, where did this come from, and how much is this effect included in the antidepressant effects of ayahuasca. In other words, it seems as though that what we have here is that the effects of ayahuasca is kind of a placebo effect with something else. So with some additional thing, but the placebo effect has to be there. So this is something, we need to explore, we need to understand, where it comes from. So just to conclude the idea of the placebo effect, what is the placebo effect? So the placebo effect is basically a effect in which you have a lot of hope, you have a lot of expectancy, you believe in something, right? So if we narrow that down a little bit, we're going to realize that at the end, we are all placebo machines. So the reason why you wake up, the reason why you do things during your day, it's basically what science has been calling the placebo effect. I do things because I believe in what I'm doing, basically, and I have expectations from what I'm doing. So we have to treat the placebo effect maybe differently. Most of the time, when we think of the placebo effect, we think of something as bad. Oh, I had a big placebo effect. But at the end, I think that it's a very important effect, and it's something that we have to work with, and we have to understand it better. As for the future of using ayahuasca here and as an antidepressant in the United States, I do see a lot of challenges. The challenges that we have here in the US, part of the challenges are due to the fact that ayahuasca is illegal here. And that makes a big difference. In Brazil, I'm not ashamed of talking about ayahuasca with anyone, anywhere. I approached the IRB, and the IRB pretty much knows what ayahuasca is. The IRB knows that there's a lot of people drinking ayahuasca in Brazil. So, we could have crude estimates of at least, well, the UDV alone reports that they have 20,000 affiliates. So let's just do a crude estimation that we have 20,000 people drinking ayahuasca every 2 weeks. That tells a lot about how safe ayahuasca is, I believe. And that tells a lot to the IRB. So I guess this is a big difference. The big difference is in part due to the fact that in Brazil it's legal for many years. The first ritual with the Santo Daime Church took place in 1930. So that's almost 100 years ago when we had our first Santo Daime session in Brazil. So that tells a lot about the relationship that Brazilians have with ayahuasca, the respect that Brazilians have with ayahuasca, the type of stigma that Brazilians have with ayahuasca is different. So maybe Brazil is certainly one of the most psychedelic countries in the world, that's for sure, and that makes a big difference, I guess. As for disentangling the mixture between the effects coming from a religious setting or something not related to the religion setting, I do believe that, well, we all know that setting is a very important thing for a psychedelic session, but once we moved the sessions to the hospital, that's already informing a lot about the effects of ayahuasca, not related to a religious setting, because all our trial was performed in a hospital with a very specific setting. We did have a session, a program session with help from us. So we were always there. We'd have music, so we were always very supportive. So although we were not having a religious ceremony, we were having a kind of ceremony in the hospital, although it was not a religious ceremony. So it was a setting, it was a set that we programmed for every subject, for every participant. But putting this all together and speaking about the placebo effect, I do believe that if we change the setting in the hospital and have the setting in the hospital as something that's closer to a more traditional use, that might have an impact on the type of results that we are seeing. To the good or to the bad, we don't know. But I'm sure that will have an influence on the results. That might be good for some people. That might be bad for some people. So some people would find, some, depending on the setting, would find that to be inappropriate. One thing is for sure is that, when we consider a session in a hospital, we tend, especially for people that understand the importance of the tradition behind an ayahuasca ceremony. One thing we have to be very clear, that people that goes to a hospital for their first experience with a psychedelic substance, they do feel safe. And that is fundamental to have a deep, profound psychedelic experience. Feeling safe is the most basic aspect of whatever experience you're going to have with a psychedelic. And from our experience, having patients with depression coming to the hospital or healthy individuals coming to the hospital for their first experience with ayahuasca, I have to say that 100% of the individuals reported feeling safe. And that feeling was very important for their experience. It was very important for having them in a more relaxed and trusted setting, so that they trust people, they trust the environment, and then therefore they would able to be part of that experience.
Bia, your mic is off again.
Sorry. Thank you. It's sad to be coming to an end because it's such a fascinating and engaging conversation. There's also many good questions. I just want to mention Daniel's comment about, there's certainly a difference between using tobacco traditionally or ceremonially.
Yeah,
I think he's thinking about like contexts like ayahuasca shamanism versus having a tobacco addiction. So that would be interesting to like cross compare. Are there people that used to use tobacco more in an addicted way, regular tobacco, and then started to use tobacco in ceremonies and just more with intention and in a ceremonial context? That's one topic. A lot of people are...
Is there time for a comment on that or not?
Okay, go ahead, 1 minute.
Yeah, just very quickly. You just mentioned that it's important that we, when you're talking about ritual use, it's different from a cigarette addiction. You have the control of cultural setting, and it's been advocated here in Brazil, at least, with the resurgence of the surgence of shamanism and the ayahuasca shamanism and the shamanisms in general, that ritual tobacco use could be a harm reduction for cigarette smoking. So this is very important that we take into account the cultural perspective, the anthropological, indigenous perspective as well. So just want to add on that.
Yeah, that was a little bit very well put and interesting. Certainly no research about that at all. We could also think about the case of Santa Maria or cannabis in the context of Santo Daime. And there's many other, parallels that we can think of, different ways of using different substances, coca and coca leaf, or different contexts, or the use of one substance to help stop the addiction of another. I just want to say that, of course, in the context of the UDV highly prohibits the use of tobacco and alcohol. It's against their religious doctrine, so that plays a big role. I want to mention that there are initiatives of starting ayahuasca study in the US. There has been conversations in MAPS. I was part of those conversations of maybe creating a clinical trial. And for different reasons, MAPS has evaluated that was too early and too challenging, but definitely an observational study to perhaps address alcohol problems in certain populations, such as Santo Daime group, is one thing that is not so much out of the radar. The legal aspect is definitely challenging. It's definitely a problem. I have written a paper about the legal dimensions of the use of ayahuasca in the US that's published in our last book. I am completely open to sharing this paper with anybody that wants to have access to this. I want to thank both presenters for their goodwill. It's also noted that they're doing this without any honorarium, and this is the honorariums of this series are entirely dedicated to psychedelic research. So that's much appreciated. Thanks for your time and your effort. We're going to have a next session of the webinar about the growing topic of interest of integration of psychedelic experiences. That's next Wednesday, October 24th, with Julie Megler, Ingmar Gorban, and Elizabeth Nielsen. Also, if you have more that you feel you need to follow up, you are welcome to send us an email at webinars@maps.org. And also remember that people can join this series at any point, and once they join, they also can have access to past recordings. And I'm just going to wrap up talking about two projects that I'm involved with the support of MAPS. So one, I want to invite everybody to join our Women in Psychedelics Forum that will happen in CIIS in San Francisco, 19th of November. That's a Monday on the week of Thanksgiving. It's a fabulous gathering with around 12 speakers, and MAPS is a co-sponsor. You can learn about this conference in our website, chacruna.net. Chacruna, you spell CHACRUNA.net. And also I want to invite you all to join the newsletter of our site, chacruna.net, where you can keep updated to the latest research. Chacruna, as I said, is a small organization trying to find its place in the US with a lot of support and friendship with MAPS. MAPS is our fiscal sponsor. And I want to just give a big kudos to our team, a wonderful group of very, very highly knowledgeable people in tech issues and all kinds of other issues. And keep on tuned, keep on following. Hope to see you here with us again next Wednesday. Thank you very much. Thanks, Dráulio and Toffoli. And please, everybody, be solidary with our mailing list and join. Okay, thank you. Bye-bye.
Thank you.
Thank you.
Thank you, Bia. Thank you, Brad. Thank you, MAPS.
Thank you, Dráulio. Thank you, Toffoli. Thank you, Bia. It's been amazing.
Thank you, guys.
And thank you, attendees. Until next time. Bye.
Bye.